I'm Bahram Mahajer, radiology resident at University of Pennsylvania, and this is Radiology in a Minute.
Outcome prediction in patients with severe traumatic brain injury using deep learning from head CT scans. The purpose of this study is to develop and evaluate a prognostic model combining deep learning of head CT scans and clinical information to predict long-term outcomes after severe traumatic brain injury or TBI. Rationale for this is that after severe TBI, physicians use long-term prognostication like impact score to guide acute clinical care, yet struggle to predict outcomes in comatose patients. This is a retrospective analysis of two prospectively collected databases. First dataset included 537 patients from one institution and were used for model development and internal testing. The second dataset included 220 patients from 18 institutions and was used for external testing. Patients with severe TBI, available admission head CT and clinical data, and no pre-existing nor surgical diseases were included. Several machine learning models were developed using head CT data, clinical and demographic data, and finally an ensemble of imaging and clinical models, named Fusion model. Outcomes included 6 months mortality, as well as unfavorable outcomes defined by Glasgow outcome scales 1 to 3. Models were tested on internal and external datasets. The performance was measured in AUC and compared with the impact model, as well as predictions of 3 attending neurosurgeons. When considering the internal test set, the best performing model, Fusion model, successfully predicted mortality and favorable outcomes at 6 months, better than impact model. When considering the external test set, performance of the model decreased. In prediction of mortality, models showed no evidence of a difference compared with impact mod scoring. In prediction of unfavorable outcomes, models underperformed impact scoring. The deep learning model outperformed the attending neurosurgeons' predictions in both internal and external test sets. Others concluded that quantitative analysis of head CT images along with clinical data improves the prediction of outcomes. They further concluded that the model can be deployed as a fast and automated point-of-care tool to help physicians prognose long-term outcomes. In a compelling editorial by Dr. Haller highlighted several important caveats, including performance drop on external dataset and difference with the real clinical setting in which neurosurgeons clinically examine the patients. Please read the full manuscript at Radiology Journal.